Okay, hi everyone. Thank you so much for joining us today and welcome to this month's Lunch and Learn research seminar. We have a really important and interesting topic today on early parenthood and out-of-home care, insights to strengthen practice and policy. I'm Jessica Stewart. I'm the Executive Director of Family and Community Services Insights Analysis and Research, also known as FACSIAR, in the New South Wales Department of Communities and Justice. Before we get going today, I would like to acknowledge that wherever we are joining today's webinar from across New South Wales, we are living and working on Aboriginal land that was never ceded. I'd like to personally acknowledge the Bidjigal people, who are the owners and First Nations people of the area where I have the privilege to dial in from. I'd like to pay my respects to all First Nations elders, past and present, and extend that respect to Aboriginal colleagues who may be joining us today. I'd also like to warmly welcome all of you. Another fantastic response to this month's webinar. We have over 750 people registered, really demonstrating, again, the interest in this really important topic. So our Lunch and Learn webinar today will focus on how to best support young people who become parents while in out-of-home care. We'll firstly be hearing from Dr. Amy Gill, welcome, from the University of Sydney, who will present findings from her PhD research, which explored the placement, service and social support needs of care-experienced young parents in New South Wales. Following Dr. Gill's presentation, we'll hear from a panel of experts who will share their perspectives on the research and discuss practical ways to better support young parents in care. I'd also like to just remind everyone we will be recording and posting this session to our webpage. So if you have registered, the webinar will become available within the next week. So we have a jam-packed session. I will quickly move through the bios for today, and then we will come to the presentations and then the Q&A at the end. Dr. Amy Gill, welcome, is a freelance research and social policy consultant with over a decade of experience in the academic, not-for-profit and government sectors. She completed a PhD at the University of Sydney in 2024, huge congratulations, as a care experienced child and family welfare specialist. Reflexivity and positionality are central to her work. Welcome. We're also incredibly fortunate to have Ali and Brianna, who are from Youth Consult for Change, also known as UC Change. UC Change is a consultancy group. It was established in 2016, and it's made up of young people who have experienced out-of-home care. The purpose of UC Change is to provide consultation that supports the department to continue to improve our practice with children and families across New South Wales. Thank you so much for taking the time today to speak with us. We also have Melissa Galea. Welcome, Melissa. Melissa is the Manager of Client Services within DCJ, looking after out-of-home care, leaving care, aftercare and quality assurance and continuous improvement across the Nepean Blue Mountains district. Her role is all about supporting children, young people and families, helping them feel safe, supported and prepared for the future. And Annalise Thompson, who is Acting Manager of Casework in Out-of-Home Care at the Hawkesbury Community Services Centre. Welcome, Annalise. She is experienced in most areas of DCJ, including out-of-home care, prenatal, child protection, carer support and the Child Protection Helpline. Thank you for coming today. Also, welcome to Sarah Radburn. Sarah is a registered nurse with a clinical background in midwifery, paediatric and adolescent nursing. Sarah commenced in her role of out-of-home care health pathway program coordinator in the Western Sydney Local Health District in 2014 and has recently returned from a secondment coordinating the Thriving Families New South Wales team, who works with marginalised at-risk young parents up to the age of 25 to improve health and safety outcomes for the family unit. It's really fantastic to have you here, Sarah. Thank you for joining us. And Melissa Pearce, who you may have seen in previous research webinars. Thank you for joining us, Melissa. Melissa manages programs and initiatives that support care leavers across New South Wales and has been working in out-of-home care programs for more than a decade. Most recently, Melissa has focused on the expansion of the specialist aftercare program, which strengthens access to supports and entitlements and improves uptake of education and training opportunities. Welcome to all of you. Again, thank you so much for your time. Really interested to hear your presentation, Dr. Amy Gill, and then to have a robust discussion afterwards. So please go ahead, Dr. Gill.
Okay, thanks, Jessica. So today I'm going to present findings from my PhD, which examined service responses to early parenthood among young people in and exiting out-of-home care to provide insights aimed at strengthening policy and practice. But before I begin, I'd also like to thank the FACSIAR team for the opportunity to speak today and the panel for contributing their collective wisdom to the webinar. I'd like to recognize the Yagara and Turrbal people as traditional custodians of the lands I'm on today and acknowledge that sovereignty was never ceded. Okay, so first, some context. A globally consistent research finding is that care-experienced young people become parents prior to age 25 more often than their majority population peers. The reasons why are complex. The two most obvious pathways to parenthood from out-of-home care are planned or unplanned pregnancies. Care-experienced young women may become pregnant unintentionally if they lack access to contraception or knowledge about how to prevent unplanned pregnancies. And unfortunately, this cohort is also more susceptible to sexual violence and exploitation that can result in pregnancy. Some young people plan their pregnancies. Cultural norms and a desire to love and be loved within a family can influence this choice. Many care-experienced young parents report a strong motivation to break intergenerational patterns of family separation by having children of their own. But before we continue, I just want to clarify that pregnancy prevention was not a focus of this particular study. So my research examined early parenthood within the context of out-of-home care using a life course approach. Basically, this means I sought to explore factors which promote positive life trajectories among care-experienced young parents and their children. From a life course perspective, leaving care and becoming a parent before age 25 are both non-normative events. So this means that they are, quote, ill-timed, unscheduled, and out of sequence in relation to broader demographic patterns and culturally specific norms. Aging out of care is atypical, so by definition, it is something most young people never have to do. As a result, care leavers are on a premature and accelerated path to adulthood. Care leavers also rarely benefit from what John Seta first conceptualized as family privilege. Family privilege just refers to the countless things that many people can simply take for granted, like being able to remain in the family home beyond an arbitrary age, return if they need or want to, and access family-based resources like emotional support, money, practical assistance. Parenting under 25 is also non-normative in most Western cultures, in that it clashes with norms about adolescence and societal expectations for the timing of education and career development. Our society predominantly views early parenthood through a deficit lens, especially if you happen to be care experienced. Care experienced young mothers and fathers are often characterized as vulnerable, at risk, and even unfit parents due to social stigma and preemptive assumptions about their parenting capacity. But it is important to remember that non-normative life events are not always a bad thing. Firstly, most victim survivors of childhood maltreatment do not become perpetrators. Those who happen to be young and have a care history share the same desire as other parents to parent well. But transitioning from care poses added burdens that can exacerbate the often challenging, time-consuming, and complex role of trying to be a good or good enough parent. The available evidence clearly indicates that care-experienced young parents are more likely to thrive when afforded a safe and stable place to live. And again, like other parents, this cohort can also benefit from access to genuine social support networks and the availability of the services that they may want or need. My PhD consisted of 3 phases. I conducted population-level data analysis to describe and define a 10-year cohort of young mothers in New South Wales with at least one history of out-of-home care placement. I conducted a small exploratory survey of needs completed by 45 out-of-home care professionals and carers. And finally, 15 semi-structured interviews with a wide range of stakeholders. So I'll be talking about each of these individually. Okay, phase one, defining and describing the population. Using administrative records, the study identified 1,811 care-experienced young mothers who were aged between 15 and 24 as of 30th of June 2019. The outcome variables we examined were birth characteristics, perinatal placement patterns, and maternal health indicators. The overall birth rate in the sample was nearly 3 times greater than a comparison sample, which was comprised of all young women in New South Wales aged under 20. So, disaggregated by age, the birth rate was 18.2% for young women aged 18 to 24 and 17% for young women under aged 18. So that is including young women who have a care history but were not in care at the time of their child's birth. 38% of young mothers in the sample had 2 or more children. This highlights that there may be potentially different support needs for families with multiple children compared to those with only 1 child. And remarkably, 1 in 10 mothers in the entire study sample aged out of care while at least 2 months pregnant. Nearly a third of these young women gave birth for the first time within approximately 6 weeks after aging out of care. Let's let that sink in. So between 2009 and 2019, 191 young women in New South Wales aged out of care while pregnant and sometimes well into their 3rd trimester. Roughly a third of young mothers under age 18 were in care at the time of their birth, of their baby's birth. Most exited before they gave birth. This demonstrates the importance of policy and practice considerations for care-experienced young mothers who don't actually age out of care, but instead are reunified or exit care to other permanency arrangements. Okay. Age at first birth. So on the screen is an almost perfect bell curve presented in a graph, and it indicates that first births were most common when young women were between the ages of 18 and 19 years old, so meaning shortly after most of them had aged out of care. For context, back in 2018, modeling by Deloitte estimated that extending the leaving care age to 21 in New South Wales would actually delay births among care-experienced young women, thus reducing the cost of social support payments for this cohort by more than something like $300 million over the course of a decade. But an important distinction for this study is that the data set is inclusive of the 2009 to 2019 financial years. So during this time, there was no staying on allowance offering financial support for young people to remain in their placements beyond 18. And I think it will be really interesting to see how this policy impacts care leave for parenthood in the long term. Location at first birth. So the map on the left shows the highest birth rates were in northern and western parts of New South Wales, and the lowest were in Sydney. The Hunter region and the Blue Mountains also had significantly higher rates of pregnancy than the Sydney region. So now the map on the right shows the location of 2 specialized residential programs for young mothers, the San Miguel Family Center in North Richmond and the Red Cross Young Parents Program, which is in Eastern Sydney. So later I'll discuss a qualitative finding that geographic areas with the highest levels of service need for care-experienced young parents also have the least amount of service access. High rates of placement changes were identified during the perinatal period. So this includes only the young people or the young women who became parents while they were in care. So there were 227 young mothers in this cohort. Just under half of these had at least 1 recorded placement change during pregnancy, and nearly 20% of those who changed placement during pregnancy did so 3 or more times in the course of the 8 months that we calculated pregnancy. Then 38% of this cohort changed placements at some point after giving birth while still in care, on average 3 times. Over 30% of young mothers who experienced postnatal placement changes had one within 6 weeks after giving birth for the first time. With regard to changes in placement type, the pie graphs at the bottom of the screen show an overall trend of entries into semi-independent living placements from all other placement types, and this is both during and after pregnancy. Finally, the population-level analysis identified some concerning maternal health outcomes. Half of the sample self-reported smoking at some point during pregnancy, and that's a much higher rate than even in the majority population of young mothers who are more likely to smoke than older mothers. Additionally, over 40% of the sample attended fewer than the 10 recommended healthcare visits for healthy first pregnancies, as recommended by the Australian pregnancy guidelines. But then nearly 10% of the sample had 15 or more prenatal health care visits, which could be indicative of pregnancy complications. But that's not something that we examined through the population level analysis. Okay, so phase 2 of the study was a small exploratory survey to identify service and support needs among care-experienced young parents and professionals who work with them. The 45 respondents included out-of-home care professionals, carers, and then 6 people who identified with both of these roles. The sample demographics broadly mirror the New South Wales workforce, so meaning they were mostly female, non-Indigenous Australians, and were working in regional areas. So care planning. There were 2 survey items about care planning for young parents. First, respondents were asked if care plans for pregnant and parenting young people typically addressed their individual parenting needs and responsibilities. 31 people answered this particular item in the survey, and most indicated that the care plans only sometimes did so. But as per the Australian National Out-of-Home Care Standard number 4, each child and young person has an individualized plan that details their health, education, and other needs, and this should be developed in partnership with carers, families, and significant others. So an even smaller sample of the survey were asked if care plans, so those who said yes, care plans at least sometimes address parenting needs, were asked to identify who was involved in the care planning process. Reported involvement among caseworkers and young mothers was unilateral. However, young fathers, families of origin, and carers were not consistently included in the planning process. Placement suitability. So the survey also sought respondents' views on the suitability of different placement types for co-residing young mothers and or young fathers and their children. And I chose these indicators that were previously identified in the literature. So there's 6 different items, and semi-independent living placements were the most highly rated for most of the indicators. As you can see, the ones in red had the highest. And this included enabling independent skill development, providing individualized support, promoting positive parenting practices, and offering aftercare support. Kinship care was most frequently identified as best suited to providing young parents and their children with nurturing environments and for minimizing the possibility of negative peer influences. But what about professionals' own needs? So the top 3 most highly ranked responses were professional development, collegial support, and formal supervision. However, 20% of professionals who responded to the survey indicated that they had never received any type of training or support from their employers on any topics relevant to early parenthood in the context of out-of-home care. And those that did mostly cited informal support from colleagues. They were far less likely to say they had ever attended a formal face-to-face training or an online module, or just self-initiated reading about this topic. Okay, so phase 3. Finally, I'm going to discuss the semi-structured interviews with professionals who support young parents in a range of capacities. This included 4 from DCJ, 7 from NGOs, offering everything from mentoring to aftercare. I also interviewed an independent solicitor who represents care-experienced young mothers, 3 young mothers, 2 who had their children after they exited care, and 1 who had their first child was born while in care. And then finally, 1 long-term carer of a young mother and infant care. And the rest of the presentation, I'll be using pseudonyms to protect their identities. Okay, so I framed these findings as practice challenges and recommendations. The first practice challenge is that placements and aftercare housing arrangements for young parents are misaligned to their needs and preferences. For context, these interviews took place online during peak COVID, and since then, as we all know, the Australian housing crisis has only gotten worse. So, participants noted concerns that young mothers in care would self-place, meaning they would leave their designated placements with or without their children because they did not feel safe or comfortable where they were assigned to be. Emily, a young parent mentor, described this as house hopping. Laura, an NGO caseworker, stated that residential care should genuinely be the last case resort in instances of high needs, but there were few alternatives for this cohort. Then finally, at the bottom of this slide is a quote from Natalie, who recalled living in a caravan park with communal toilets 100 meters away when she was 7 months pregnant as a recent caregiver. And she told me, gosh, that caravan was so cold. Practice challenge number 2. A lack of placements and housing leads into the risk of homelessness. Donna, who's a solicitor representing care-experienced young mothers, explained that, quote, often they are homeless and there's still an order of allocation of parental responsibility to the minister. Meaning, she was describing working with unhoused, pregnant and parenting young people in out-of-home care who had nowhere safe to go at night. Kathy, a DCJ prenatal child protection worker, explains that the homelessness problem in her region was so appalling that care-experienced young mothers end up transient and they end up exploited by people so they can have somewhere to stay. Lacey, a young mother, related her experience of experiencing more difficulties competing in the private rental market after she and her partner lost their rental bond upon vacating a property. Finally, Kathy offered the example of an emergency situation. So a young mother and her baby might be given motel accommodation for perhaps a week. But if they have a visitor and the motel operator decides to report them to the authorities, they can be banned for a year, thus preventing the mother and her child from accessing this vital type of crisis accommodation. So this is one of the types of situations that creates practice challenge number 3. Practice challenge number 3 is that homelessness leads to family separation. So firstly, Gemma, a parenting educator in a residential program that was specifically for young mothers or young parents, she described how 2 out of 4 parents entering the program left within a month, and as a result, their children were removed from their care. Donna, the solicitor, explained that children born to care-experienced young mothers are often placed into foster homes without their mothers. So mother and child are separated unless they get placed into the 1 or 2 services available for them. Finally, Jessica, an aftercare caseworker, pointed out that young mothers will only meet the eligibility criteria to enter the priority housing queue after their children are removed due to homelessness in some instances. The Australian housing crisis is contributing to intergenerational trauma associated with disrupted family attachments. Disrupted attachments in infancy can lead to challenges with building and maintaining healthy relationships well into adulthood. Disrupted family attachments are a type of early childhood trauma, and early childhood early childhood trauma is itself broadly linked to a whole range of adverse life outcomes. Now, time for solutions. So I have 6 recommendations grounded in relationship-based practice for working with care-experienced young parents and their children arising from the study. The first is to be consistent. Natalie offered an example of a worker who took the time to understand that displays of aggression can manifest because people express emotions differently to how they feel. Then Steve and Laura discuss the importance of building up rapport over time, so young parents come to believe that workers really and honestly care and will act in their best interests. As Laura explained, it was important to differentiate herself as a caseworker from just another service who wants young parents to come to their playgroup. The second recommendation is to attend to power differences. This means recognizing that professionals, carers, and other adults have more control over the young parent's life than they do themselves. Previous research consistently indicates that young people in care often do not feel heard and do not feel like they have enough of a say in decisions about their own lives. So it follows that care-experienced young parents also feel like they lack autonomy about the parenting decisions about their own children. Mel summed this up by reflecting on her role as a parenting education provider. She said, "I'm just another face of the system, you know?" Gemma explained how she supported young parents to empower themselves by offering them input in her parenting course content. For example, she organized for an external presenter to come explain how Centerlink benefit entitlements work and how to navigate that complicated application process at the recommendation of the young mothers. Kathy offered another practical example, which is to meet with young mothers in places where they feel comfortable to help minimize the trauma associated with child protection offices. So this shows that little things can make a really big difference. My next recommendation is to be authentic. A relatively unique finding from my study is that some professionals spoke about going through the process of emotional healing from their own histories of trauma and adversity to be able to draw on this from a place of strength in their own professional practice. So Mel explained how this creates a deep trust and rapport that helps young parents because you're not just teaching it, you've actually lived it. And for Jessica, this might simply mean being the mother figure that care-experienced young mothers are looking for, or could be looking for. Lacey offered some constructive criticism. She stated, "Counselors do not understand. They can't put themselves in your shoes." Well, obviously, it's harder for young people to connect with professionals who might appear distant or unrelatable to them. They want people who get it. For example, I disclosed my own care history in each interview. And in response, one young mother expressed relief. She said, for once, she wouldn't have to try and explain to some new professional what it really meant to be a care kid because I get it. Good practice recommendation 4, honesty. Honesty can refer to using plain language and taking the time to explain things like acronyms and assessment processes to young parents. According to Claire, who's a long-term carer of a young mother and her child, honesty meant receiving clear guidance and expectations so that her household could help avoid family separation in another generation. And as Natalie pointed out, honesty among professionals also includes being able to articulate their own feelings to young people in an appropriate way. So she offered the example of a worker who, in going over a subject with her, would say, "Today I feel like we should do a different subject because I myself, as the professional, am not sitting in an okay spot today." Good practice recommendation number 5. Positivity. Positivity was portrayed in many different ways by different participants. For Natalie, it meant if you haven't got someone to come visit you in the hospital when you've had the baby, they'll come up and they'll see you. So, not as a child protection assessment, not some other form of mandated contact, but as someone who's simply offering well wishes to a new mother and her baby. Claire highlighted that it meant a great deal to the young mother in her care when one worker in particular was encouraging, just simply telling her she was doing a good job. Mel described facilitating open yarns, where young parents could talk about the judgment and the stigma that they face on a daily basis. And then finally, Zoe reflected on the importance of just taking joy in babies. So she explained how she made a point of saying things like, "Look at that gorgeous baby. Look what you made," in her role as a DCJ intensive caseworker specialist. My final good practice recommendation is sensitivity to the challenges of parenting as a care-experienced young person, often with little resources. So it includes being sensitive to the stigma they experience and to the common but maybe not entirely irrational fear that authorities might just come and take their children away one day without warning. This message was loud and clear from the young mothers. Natalie said, "My biggest fear the whole time was, are they going to get involved just because I was a care kid and I'm young?" Lacey recounted a professional who, quote, "literally said to me, because your parents were not that great, they didn't think I would be that great of a mother." So Sean, a DCJ child protection psychologist, emphasized the importance for professionals to understand the function of behavior. And in reflecting on what might be characterized as disengagement from service providers, he explained, kids in out-of-home care have all these different people coming and going constantly, and they have no idea what their role in their life is. It's just another person they're expected to attach to. And Mel put it simply. She said, they've been so let down that they don't allow themselves to get close to anyone. So, in conclusion, here are 4 policy recommendations arising from my study. Number 1, extended out-of-home care is vital to care-experienced young mothers who are most likely to give birth for the first time between the ages of 18 and 20. So let's keep the home stretch campaign going and not stop at age 21. Number 2, address the housing shortage. Care-experienced young parents who may be single or coupled all need safe places to raise their children. This is especially important in regional areas with higher rates of care leave or early parenthood, as it can prevent young parents from having to relocate away from their familiar surroundings and existing support networks for housing. Number 3, in alignment with the Australian National Standards for Out-of-Home Care, care planning must comprehensively address the needs of both parent and child. There needs to be meaningful input from every stakeholder. Where appropriate, young fathers, families of origin, chosen family, and anyone a young parent identifies as a support person should be invited to participate in this process. Finally, professionals and carers need more training, more support, and more resources to ensure that they are highly equipped to work with this cohort. This can help ensure that care-experienced young parents and their children can expect to have the same life chances as their majority population peers. These are some publications arising from the study, and the links are available on the FACSIAR website. Thank you.
Thank you so much, Dr. Gill. It was really, really important research and great to see it from those different angles. By all means, people, please put your comments and questions in the chat. We're going to move to the question and answer section now, and I'll come to any questions that you may put in the chat at the end if we have time. So as part of our panel, we'll first hear from Ali and Brianna, who are consultants with UC Change. UC Change consultants, as I mentioned earlier, use their experiences and knowledge to provide advice to the department. Their expert advice is then used to improve the services and support offered to children and young people in out-of-home care, making sure that DCJ's work is responsible to the needs of children and young people and actively promotes their well-being. Today, Brianna and Ali are going to share some advice and recommendations regarding how practitioners can support young parents who are in out-of-home care. Thank you so much for joining us. I might start with Brianna. How can workers ensure the needs of young parents in care are being met?
So I think throughout the interviews, the quotations that we used are a good example of what people aren't getting. Um, you need workers to actively listen and allow you to act, give you the opportunity to act in the best interest of your child and yourself. And I know I went through, I started being a parent from a young age. I was 18 when I had my first daughter. And because of my care experience, it was like everything was under a microscope from conception. And that's a really overwhelming feeling. So when you have a worker who can support you emotionally and physically and use all the resources available to them to help you be a good parent and to support you through that journey, it's really helpful. Even things like showing up and having a morning tea or having a coffee with the young parent at their home, just checking in, showing that you're there and that they have someone that they can turn to. Obviously, they don't have those traditional family supports, and that is really difficult in itself. So having someone who can just take a moment and check in on them, it makes a world of difference.
Thank you so much. And you've touched on this, but are you able to expand on how you see out-of-home care services better supporting young parents who are in care? Are there additional services that you think are important?
I think having people who are equipped to help those young parents access different services. There are a lot available, but sometimes it's quite overwhelming trying to navigate how to enroll your child or enroll yourself. I think a lot of young parents feel a bit of stigma already because they're in care, but then on top of it, they are under that age bracket having babies for the first time. So reaching out to mental health services can be difficult, especially when you have a little one in tow. So showing up and providing care for that child while you do go out to access health services for yourself. I think the most important thing is that workers are equipped with the skills and the resources and can make the time for them to navigate that.
Thank you. Thank you so much. And Ali, if you're happy to talk about what's important for caseworkers to be aware of when working with young parents from your perspective as well.
Yeah, I think they need to be aware of the fact that when working with young parents, it will take time for them to feel safe and trust that the caseworker won't remove their child off them. I know it's a massive fear for the majority of young parents within the out-of-home care system. Also many young parents experience so much judgment from a lot of those around them in private and public. So off that, I think caseworkers need to be aware of their well-being as a whole and give them the correct guidance and support that they need.
That's
Um,
true.
yeah.
Sorry, go ahead.
Um, I think it's also important for the caseworkers to be mindful of the important factors of the young parents' child's father. So for instance, if the partner, the father has a history of domestic violence or substance abuse, if that father is living with them, if they've got that history, and if the young parent would need support around that. So like if there's ABOs or anything in place for that.
Thank you so much for both of your expertise and for sharing your experiences. So again, people, please put any questions you may have for our panel members in the chat, and I will now move on to Melissa Galea and Annalise Thompson. So, Melissa and Annalise, how can the DCJ prenatal team best support care experienced pregnant parents?
Team is a voluntary team that provides early support and assistance to reduce the likelihood of babies entering out of home care once they're born. Prenatal caseworkers work hard to build strong, positive relationships with the expected parents, and they work with both mums and dads during the prenatal period. Prenatal caseworkers are able to assist expectant parents with many issues that they might be facing, including homelessness and help with accommodation, mental health services, drug and alcohol services, collaboration with health and referral for pregnancy family meetings, transport to health and other appointments, and helping with practical items that are needed for baby, including nappies, formula, car seats, and other items that they might need. A referral for the prenatal team is made through a ROSH report through the helpline, and young people that are in out-of-home care are prioritised. A referral can be made at any point during the pregnancy, either very early or very late during the pregnancy, because assistance from a prenatal caseworker at any point during the pregnancy can be really beneficial for young people that are in out-of-home care. It's important to seek consent from the young person prior to making a referral, because engagement with the prenatal team is voluntary. And there's also a service called Your Voice, which is a children's out-of-home care advocacy service through Legal Aid that provides legal advice and assistance for young people in out-of-home care.
Thank you. And how do people best access the prenatal caseworkers or the prenatal team?
Okay, so referrals can be made through ROSH report, or otherwise there's prenatal teams in Western Sydney, Nepean, Blue Mountains, and across the state as well.
Thank you. And in the research that was presented by Dr. Gill, many issues came up in gaps in service delivery. How have you seen these gaps affect care experienced young parents in your practice?
I wanted to thank Amy for really pulling together that research. I think what it does is highlight so many of the complexities that our young people navigate when leaving care, especially around placement changes, placement types. What we have been trying to implement across Nepean Blue Mountains for our care leavers is looking at family group conferencing early. So once that leaving care plans start, so that way we can have a really good understanding from the young person around who is in their network, because we acknowledge the housing crisis for our young people is the biggest risk factor for them to navigate. But also understanding for any of our young people who might be referred to the prenatal team or working with their out-of-home care caseworker, some of their fears, like Ali and Brianna talked about. We acknowledge that so many of our young people are scared. What does engaging with DCJ mean for their pregnancy? Does it mean that we're going to take their baby away from them? And I think that being honest and open and transparent with our care leavers around what is it that they need, seeing them as a person and not just a young person who's pregnant, but they themselves have an idea around what it is that they want to achieve, what their life wants to look like, and how do we get them to their goal. And so what we do in Nepean Blue around our aftercare is also when we do have a care leaver who's come to us for assistance, looking at their aftercare plan, reviewing their aftercare plan, looking at what other financial supports can we put in place for them if they've had a baby or two whilst they've left care, and looking at what other resources are available to support them, acknowledging sometimes our care leavers are really have that fear around engaging with health. And what does that mean if they don't engage with health? Then what other options are there for them?
Thank you both. And that's a great segue to our health colleague who's joined us today, Sarah Radburn. Sarah, how can the out-of-home care health pathway program best support young parents?
Yep, so the out-of-home care health pathway program provides assessment and health management plans for children and young people that come into care. From the age of 15, we start looking and working with the young person to develop a leave-in care plan and working with the caseworker. And we need to meet the young person where they're at and what they need, no matter what the circumstance is. Whether that is they are becoming young parents, whether they are already young parents, whether they need culturally appropriate services or be referred to culturally appropriate support services for parenting, and that sort of thing too. And we try and work really closely with the caseworker and the young person, so that the young person's voice is heard in what they want, what they need.
Thank you. And from your experience, what makes the biggest difference in supporting young parents?
As I mentioned before, it's meeting the young person or and the young parents, mum, dad, and baby, where they're at, and working with them to work out what their goals are, looking at the domains of health, so their social, their physical, their emotional, their education, their, what are their work plans, and being open and approachable to be able to hear them and take on board what they say, and being able to provide the right support networks around them for parenting, as well as what they need for themselves too. Because during this time, there's a lot of concentration around the baby and safety and minimising risk. But once we work with the parent, and once the parent is heard, the young person is heard, and once the rapport is built, then hopefully that can help the young parent feel comfortable with working with each other.
Thank you, Sarah. Thank you so much. So we're going to move now to a quick presentation from Melissa Pearce. Just before we do, I just want to mention the numerous comments in the chat just expressing gratitude to Ali and Brianna for your expertise. Thank you so much again for sharing your wisdom. So over to you, Melissa, and then if we have time, we'll come to some questions at the end.
Thank you. And thanks, Amy. That was an amazing presentation. I loved all the insights from young people and from the other panel members. So many practical practice advice and insights. And some of the slides you'll see from me reinforce this. But I just wanted to talk a bit about care leavers as young parents from a leaving and aftercare angle. Just to say, of course, that we know they're significantly overrepresented as a group, both while they are in care and post care, and that not all pregnancies are unplanned, and some young people are actively choosing parenthood, seeking love, family and connection. But with the right support, parenting can be actually a positive turning point. But without it, young parents do face stigma, isolation and disadvantage. And I wanted to mention that young people are more than just their care leaver identity or their young parent identity. They're a young person in their own right with their own hopes, goals and dreams for the future as well. Thanks. So common challenges, which again, we've heard some of these already in this session: isolation and loneliness, mental health risks, financial stress, the risk of relationship breakdowns, not just perhaps with their partner, for example, when fathers are excluded or unsupported, but there could also be a disconnect from family or carers they trust around this time. And of course, the surveillance bias that the care history is used to judge their parenting ability, and this can lead to mistrust or late disclosure of pregnancy. and what young parents say helps, which are building on some of the fantastic insights from Dr. Gill's presentation. Genuine, non-judgmental relationships, so just a sense of feeling supported rather than assessed. Early confidential advice about pregnancy, parenting, what are the available services? Do they know? Have they got a great GP? Do they know where the family planning office is? Youth-friendly services. They're still young people, so are they flexible, accessible, and tailored to young parents? Support for fathers is often kind of forgotten, recognising their role and encouraging shared parenting where that's, important, appropriate. Advocacy and planning, especially around housing, income, education and parenting skills, and a bit of coordination around that. That does take a bit of time, we've heard, but that sort of rolling our sleeves up as support, as caseworkers, making sure we're helping with some of that coordination. So as the practical tips, again, some of this has already been mentioned, asking about parenting goals early, not assuming, talking about things like contraception, relationships, family planning. Let's not assume someone else has had some of those conversations. It's surprising how many young people can miss out on those important conversations that we take normally happen over time in family-based settings. Helping young people plan ahead. So get in early with housing planning. Please don't leave it to the last minute as a ticker box. Really think early about, what are the options? Have a plan B when it comes to housing. Talk about personal support networks. If we work with younger teenagers, building their personal support networks, these can sometimes result in housing options later on when they're wanting to move out or move to live closer to a TAFE, for example. Social inclusion, connecting young people with peer groups, young parenting programs, hobbies and interests and online communities. I can't emphasise enough this importance of hobbies and interests. People need connection and social inclusion, and this often comes about through hobbies and interests. And you can have a baby and still have a hobby or interest. And in fact, that's probably even more important for your mental health. So just this idea of thinking about that for our young people. Supporting fathers' involvement, already mentioned that one, and just being mindful of language and tone, avoid reinforcing stigma or surveillance bias. So some of these have already been mentioned, but, infant care basics, parenting expectations. So just talking through roles, expectations, affection, what does shared responsibility look like? Some of these concepts that are really hard to get your head around when you're a young person as well, and maybe not have had that much life experience. Parenting competence, interpreting and responding to a baby's needs. I mean, I remember being a parent myself, and this whole thing freaked me out. So I can imagine if you're younger, it's tricky, and having some guidance and support that's not judgmental is so important. And things like living skills, let's not forget, it's not just all about the parenting skills, but back to basics on things like cooking, budgeting, why credit cards and afterpay aren't always good, learning to drive, especially if you're going to be a young parent in a regional area and no one's helped you have driving lessons yet. Like our caseworkers, just really encouraging caseworkers to get onto some of that stuff really early to support young people. So practical supports that go beyond parenting. So we've already talked about financial support. So things like the independent living allowance, Tiller, connecting into Centrelink, helping source essential items, safe and stable housing, early planning, what are the accommodation options. But I do really want to recognise that there are some real housing challenges out there, particularly in regional areas. Education and employment pathways with flexible childcare, what are the transport options, and the planning to consider the costs and needs for participation. So this goes back to this idea that young people are more than just their care leaver identity and their young parent identity. They, support young people to think about what their hopes and goals are for the future alongside of these other parts of their life. and information and advocacy. We have a very large, complex service system in New South Wales, and there are a lot of programs and supports out there, but it's a challenge to navigate. So helping young people navigate those systems, understand their rights and access the right supports at the right time. And thinking about what's the impact of doing some of this, it does reduce stress and it creates space for young parents to focus on their goals. Thank you. Planning and respectful practice. Again, I won't go through all of this because we have kind of said it before, but planning for the person, not just the parent, support to navigate services, and trauma-informed respectful practice. Thanks. And just a shout out to say, in addition to Amy Gill's fantastic research presentation, there's all sorts of incredible resources out there. And I just wanted to give a plug for Cardiff University's work they've done. They've got a best practice charter, which I've been stalking, and it's got some great tips. But I know there's another one, Barnardo's UK, have got some great resources as well. So just, check out what's going on out there. There's some really great practice tips and resources we can get ideas from, borrow from, wherever we are, wherever we're working. Thank you. So key takeaways: care experienced young parents have skills, resilience and ambitions that deserve to be recognised and supported. So please don't forget about social inclusion, hobbies and interests and work and study goals alongside all that focus on supporting a young person as a young parent. What are the game changers that can really make a difference for this particular young person? Ensure services are inclusive and strengths focused. Young parents can lead lives that reflect who they are, not just the challenges they've faced, and raise children who feel secure, supported and connected. And support needs will vary. Some young parents may need minimal assistance, others will benefit from more intensive, coordinated support. But what matters is that the right conversations happen earlier, indeed much earlier, and the right supports are in place when they're needed. And thanks again.
Thank you so much, Mel. And just before we come to some of the questions in the chat, we have extended this session until 1:15, just so that we have a bit more time given the number of people involved in presentations. So, Jeev, do you mind bringing up Melissa's presentation? I'm really interested in Brianna and Ali's reflections on slides 6 and 7 about what the priorities you see in terms of support needs. Are you able to bring back up the Melissa Pearce's slides that were just up? So slide 6. So, Melissa, you talked about building parenting confidence and skills around infant care, parenting expectations, parenting competence, support, living skills like cooking and budgeting. And then I think on the next slide, you talked about financial and material support, such as essential goods, safe, stable housing, education and employment pathways. Just really interested, Ali or Brianna, if you're interested, if you're able to comment on what you see as some of the key priorities in those areas.
As a young mum, I think something that would stand out for me was having those living skills and having that kind of support in how to be a parent. Obviously, you come from a background where your parents haven't done the right thing or weren't capable, and you were removed. And so you feel constantly like, am I doing the right thing, or is my child going to be taken away from me? And that's what I was talking about being under that microscope. So when you are equipped with the skills to cook and budget correctly and drive a car and go out and do what you need to do in order for your child and yourself to be looked after, it makes a world of difference.
Thank you. Ali?
think the main one that stands out for me there is relationship support. So support within relationships with siblings, family, friends.
Excellent. Thank you. Thank you so much. Thank you, Melissa, for your presentation as well. Just in the last few minutes, so there was some discussion around prenatal being the prenatal caseworker support being consent-based. What is the outcome if young people don't consent, and when and why would a high-risk birth alert be placed? And second to that, if a young person is in care, how does that consent work? I can see some responses, but it might be worth just touching on that in the discussion. Maybe Melissa or Annalise or, yep.
So for our young people who are already in out-of-home care, I noticed there was a good question about, does that mean that child automatically gets an order? That's not how it works, but what we do is encourage our young person to get legal advice, such as, from Your Voice, which is a legal representation from Legal Aid for children and young people in out-of-home care. And that will really help guide consent, especially I think for some of our really young mums who are in out-of-home care, such as 14 or 15 and dependent on some of those circumstances, it becomes more of a child protection issue within the out-of-home care space as well for that child and for the child to be born. I think it's also interesting, I could see some of the comments around dads, and one of the challenges in that prenatal space is around identifying dad, and dad doesn't really become a party until baby's born. Not that we feel that that's how it should be, but if mum does consent, as in that prenatal space, to have dad on board, we absolutely work with dad and the extended families. I hope that's been helpful.
Thank you. And I'll just read out a comment as well, which might be worth clarifying, which is related. So in Queensland, there is an issue where if a young person in care becomes pregnant, in most cases, they cannot remain in their placement unless their unborn baby is also placed on a child protection order. If the young person leaves the placement to avoid an order, often that can result in homelessness and having the baby removed. Is this something that also occurs in New South Wales? And does the panel have thoughts and ideas around this barrier?
No, it doesn't. I think what we do see for our young people in out-of-home care who are pregnant is often placement changes, which Amy talks about in her research, and how that increases a young person's vulnerability. And that's where the prenatal team really came in to effect around how do we support these young mums around not only their own care experience, but them as a person and as an expectant mother, and what do we need to do to support them. We've all touched on the difficulties around housing. For us in Sydney and Metro, Nepean Blue Mountain supports all the way from St Mary's to Lithgow. And what we have found is really limited placement supports available for our young people. What we have done is work with housing really early on for some of those care leavers. But one of the other challenges has been the no wrong door policy. So a care leaver can go to any CSC and request assistance. And so what we then find is we have to then really understand for that young person what some of their barriers have been. And often we find it's lack of stable, supportive accommodation, lack of support networks. And so we then look at what other ways can we support that care leaver. And when capacity allows, we've also allocated that care leaver to our aftercare team to provide more intensive support in that initial phase.
Terrific, thank you. Amy, do you have reflections as well on that?
Yeah, as I said in the comments responding to the other Amy, is that, I mean, yes, this happened. This was relayed to me in incidents in my research, but we have to remember, firstly, that these interviews took place a few years ago now, so things are always getting better, number one. And number two, the incidents that participants were describing to me almost unilaterally involve self-placement, which is a little bit different to being a care leaver, to have already exited care, and it's a little bit different to just your regular placement change. So context is important, but it's, yeah, housing is going to be the biggest thing. Safe housing for that young parent to be able to safely raise their child is the biggest problem, I think, that came out of my research, and it's one of the biggest practice problems. And until the housing crisis is solved, it's going to continue to be a problem, unfortunately.
Thank you. So we might need to leave it there, but if just before we go, if I can just ask each of our panel members and presenters, if there's one key message you would like our audience to take away today, what would that be? And can I start with you, Amy?
Yeah, so I guess I'll just say that I'm really pleased that the need to improve supports for care leaver parents and their children is finally gaining momentum here in Australia as a issue of significance in not only research but policy and practice.
Thank you. And Annalise?
I'd just like to remind everybody that referral to the prenatal team can be made for young people in out-of-home care who are pregnant at any point during the pregnancy, and engagement with the prenatal team at any point is really beneficial for young people in out-of-home care.
Thank you. Melissa?
My takeaway is that our care leavers are people. They are human. We need to listen to them and not always dictate what needs to happen. Sometimes they have the best ideas around what support that they need, and by actively listening to what their needs are, hopefully we can have a great outcome.
Thank you. Sarah?
Sorry, it wouldn't come off mute. It would be to start planning for leaving care early in every domain. So health, psychosocial, education, working, housing, so that the young parents have that behind them and don't have to worry about it once they've become parents and looking after a little one as well.
Thank you. Melissa? Pierce?
Yeah, I would say planning early for housing and focusing in on what are the game changers for that young person. Is it the learning to drive? Is it the housing? Is it connecting in with those financials? Like, what are the game changers that will really make a difference to their confidence and their journey, both as a care leaver and as a young parent, and just thinking about their personal hopes and goals for their own future as well. Thanks.
Thank you. And finally, so if there's one key message, Ali, what would you like the audience to take away today?
Keep in mind that all young parents have different paths and experience and will all need different support suited to their situation. Don't give the same support for each young parent.
Fantastic. Thank you. And Brianna?
I would say empower young parents by equipping them with the skills and the resources that they need, and let them feel supported in a journey that, is new and different for them.
Thank you so much. Well, thank you all so much for today. It's been really a very important discussion, really important research, and great practical experience being shared today. So thank you. Everyone that's registered will receive a link to the recording of this webinar within the next week. We've also posted some material related to today's Lunch and Learn research topic. Our next Lunch and Learn will be on Tuesday, the 18th of November at 1 p.m. We're looking at housing, home and health, understanding Aboriginal social housing tenants' experiences. We hope to see you there. And for now, thank you all so much, and take care and enjoy the rest of your week. Thank you.